1. A nurse is caring for 4 clients. Which client should the nurse assess first? A client with stable angina, complaining of chest discomfort. A client with a history of CAD who is experiencing shortness of breath. A client with chronic heart failure receiving a diuretic. Or a client post-coronary stent placement requesting pain medication for a groin site. Answer: the client with a history of CAD who is experiencing shortness of breath. Rationale: shortness of breath in a client with CAD may indicate heart failure or acute coronary syndrome and requires immediate assessment. It represents a potential life-threatening condition. 2. A nurse is teaching a client with coronary artery disease about modifiable risk factors. Which of the following client statements indicates a need for further teaching? I will stop smoking. I will manage my stress. I will monitor my cholesterol. Or I can't do anything about my blood pressure? Answer: I can't do anything about my blood pressure. Rationale: hypertension is a modifiable risk factor. The belief that it is unchangeable shows a knowledge deficit requiring further teaching. 3. The nurse is delegating tasks on a cardiac unit. Which task is appropriate to delegate to a licensed practical nurse? LPN monitoring for chest pain, administering for nitroglycerin, developing a discharge plan, or interpreting a cardiac enzyme report? Answer: monitoring for chest pain. Rationale: LPNs can monitor patients and report findings to the RN, but for medications, discharge planning, and interpreting diagnostics are outside their scope. 4. A client admitted with unstable angina suddenly becomes pale, diaphoretic, and hypotensive. What is the nurse's priority action? Answer: administer oxygen and notify the provider immediately. Rationale: the symptoms suggest possible myocardial infarction or shock. Oxygen supports perfusion, and prompt provider notification ensures timely intervention. 5. A client with CAD is prescribed atorvastatin. What should the nurse prioritize in client teaching to ensure safety? Answer: report any unexplained muscle pain or weakness. Rationale: statins can cause myopathy or rhabdomyolysis, a serious adverse effect. Early reporting prevents complications. 6. The nurse receives a report on 4 CAD clients. Who should be assessed first? A client with new-onset atrial fibrillation, a client with stable angina post-exercise, a client who received nitroglycerin an hour ago, or a client who missed a morning aspirin dose. Answer: the client with new-onset atrial fibrillation. Rationale: atrial fibrillation in CAD increases the risk of embolism and hemodynamic instability. It requires immediate evaluation. 7. A nurse is reviewing lab results for a client with CAD. Which finding requires immediate intervention? Total cholesterol of 210 mg per deciliter, LDL of 180 mg per deciliter, triglycerides of 150 mg per deciliter, or HDL of 40 mg per deciliter. Answer: LDL of 180 mg per deciliter. Rationale: LDL levels above 160 mg per deciliter are high and significantly increase cardiovascular risk, requiring intervention. 8. Which instruction is most important for a client being discharged after a myocardial infarction? Answer: call 911 if chest pain is not relieved within 5 minutes after taking 1 nitroglycerin tablet. Rationale: this action ensures timely emergency response in case of recurrent infarction and improves outcomes. 9. A client with CAD is prescribed metoprolol. What should the nurse monitor before administration to ensure safety? Answer: check blood pressure and heart rate. Rationale: metoprolol can cause bradycardia and hypotension. Monitoring these vital signs prevents adverse effects. 10. Which task is appropriate to delegate to an unlicensed assistive personnel? UAP, caring for a client with stable CAD. Answer: obtain and report vital signs. Rationale: UAPs can perform routine tasks like vital signs. They must report abnormal findings to the nurse. 11. A client reports taking sildenafil while being treated for angina. What is the nurse's priority action? Answer: notify the provider before administering any nitrates. Rationale: nitrates and sildenafil together can cause life-threatening hypotension, and should not be given concurrently. 12. A client with CAD reports intermittent chest pain at rest. What does this likely indicate, and what is the nurse's immediate response? Answer. It likely indicates unstable angina. Initiate continuous cardiac monitoring and notify the provider. Rationale. Pain at rest is characteristic of unstable angina, a medical emergency requiring close monitoring and intervention. 13. What is the priority assessment after administering sublingual nitroglycerin for chest pain? Answer. Assess blood pressure. Rationale. Nitroglycerin can cause hypotension. Monitoring blood pressure ensures patient safety after administration. 14. A nurse is preparing a community education session about CAD. Which key points should be emphasized regarding physical activity? Answer. Gradual increase in activity is essential, and symptoms like chest pain or dizziness during exercise must be reported immediately. Rationale. Safe activity promotes cardiac health, but symptoms may indicate inadequate cardiac perfusion and require prompt attention. 15. A nurse receives 4 calls from clients with CAD. Which client should the nurse call back first? The one with a new prescription for statin reporting dark-colored urine, one with mild headache after nitroglycerin, one who missed a dose of beta blocker, or one asking about dietary changes? Answer. The client with a new statin prescription reporting dark-colored urine. Rationale. Dark urine may indicate rhabdomyolysis, a serious side effect of statins, and requires immediate evaluation. 16. The nurse notes ST segment elevation on the ECG of a client with chest pain. What should be the nurse's first action? Answer. Notify the provider and prepare the client for possible reperfusion therapy. Rationale. ST elevation indicates myocardial infarction. Immediate treatment is required to restore perfusion and minimize damage. 17. A nurse is educating a client with CAD about the DASH diet. Which dietary choice should be emphasized? Answer. Choose foods low in saturated fats and rich in fruits, vegetables, and whole grains. Rationale. The DASH diet is proven to lower blood pressure and improve cardiovascular outcomes in clients with CAD. 18. What is the most important goal of care for a client with chronic stable angina? Answer. Prevent progression to myocardial infarction. Rationale. Managing stable angina involves preventing complications such as acute coronary syndromes and infarction. 19. A nurse is teaching a client with CAD about nitroglycerin use. What is a critical instruction to prevent complications? Answer. Sit or lie down when taking nitroglycerin to avoid dizziness or fainting. Rationale. Nitroglycerin causes vasodilation and may lead to orthostatic hypotension. Positioning helps prevent falls. 20. A client recovering from a myocardial infarction refuses to participate in cardiac rehabilitation. What is the best nursing response? Answer. Explore the client's concerns and provide education on the benefits of rehabilitation. Rationale. Addressing barriers and providing education promotes adherence to rehabilitation, which improves long-term outcomes. 21. A nurse is preparing to administer morning medications to a client with CAD and newly prescribed diltiazem. What should be the nurse's priority assessment before administration? Answer. Assess the client's heart rate and blood pressure. Rationale. Diltiazem is a calcium channel blocker that can cause bradycardia and hypotension. Vital signs must be evaluated before administration. 22. A client with a history of CAD reports chest pressure radiating to the jaw and nausea. What is the nurse's immediate priority? Answer. Activate emergency response, administer oxygen, and prepare for ECG and cardiac enzyme testing. Rationale. These are classic signs of myocardial infarction requiring immediate intervention to preserve heart muscle. 23. During a staff meeting, the nurse manager asks for feedback about improving outcomes in CAD clients. Which nurse response reflects an evidence-based practice approach? Answer. Encouraging early cardiac rehabilitation enrollment post-discharge improves long-term survival and functional status. Rationale: research supports early rehabilitation in reducing readmissions and improving cardiovascular outcomes. 24. A nurse is caring for a client post-coronary artery bypass graft, CAB surgery. Which assessment finding requires immediate provider notification? Answer: chest tube drainage of 200 milliliters in 1 hour. Rationale: excessive chest tube output may indicate postoperative hemorrhage and requires prompt intervention. 25. A client with CAD reports skipping beta blocker doses due to fatigue. What is the nurse's best response? Answer: explain the importance of not abruptly stopping beta blockers and notify the provider about the side effect. Rationale: abrupt withdrawal can lead to rebound hypertension or angina. The provider may adjust the dose or try another drug. 26. A client newly diagnosed with CAD asks why aspirin was prescribed daily. What is the most appropriate nurse response? Answer: aspirin reduces the risk of clot formation, lowering the chance of heart attack. Rationale: aspirin inhibits platelet aggregation, helping prevent thrombotic events in CAD clients. 27. A nurse is caring for a client with CAD and observes frequent premature ventricular contractions, PVCs, on telemetry. What is the nurse's priority action? Answer: assess the client symptoms and check electrolyte levels. Rationale: frequent PVCs may indicate myocardial irritability, often triggered by hypokalemia or hypoxia. Assessment and labs are necessary. 28. A nurse teaching a group of older adults about CAD prevention emphasizes which key point related to age-related risk? Answer: aging causes blood vessels to stiffen, increasing the risk of atherosclerosis and CAD. Rationale: age is a non-modifiable risk factor, but understanding its effects promotes earlier preventive measures. 29. A client with CAD is prescribed nicotinic acid. Which client report should the nurse address immediately? Facial flushing, tingling, blurred vision, or mild nausea? Answer: blurred vision. Rationale: blurred vision may indicate toxicity or serious side effects. Facial flushing is common but not dangerous. 30. A client is experiencing chest pain unrelieved by 1 dose of nitroglycerin after 5 minutes. What is the nurse's next action? Answer: administer a second nitroglycerin dose and call emergency services if pain persists. Rationale: up to 3 doses can be given 5 minutes apart, but ongoing pain warrants emergency evaluation. 31. During a home visit, a client with CAD reports missing follow-up appointments due to lack of transportation. What is the most appropriate nursing intervention? Answer: refer the client to a social worker to arrange transportation services. Rationale: addressing social determinants of health improves adherence to care and reduces complications. 32. A client with CAD is advised to take fish oil supplements. What client statement indicates understanding of this therapy? Answer: this may help reduce my triglyceride levels. Rationale: omega-3 fatty acids in fish oil can lower triglycerides and have beneficial cardiovascular effects. 33. A nurse notices a client with CAD has developed a new S3 heart sound. What is the clinical significance? Answer: it may indicate early signs of heart failure. Rationale: an S3 heart sound suggests fluid overload or ventricular dysfunction, requiring further evaluation. 34. A client with CAD is being educated about transdermal nitroglycerin patches. What instruction is most important? Answer: remove the patch at night to reduce tolerance. Rationale: a nitrate-free interval helps prevent nitrate tolerance and maintains drug effectiveness. 35. A nurse is reviewing discharge instructions for a CAD client starting clopidogrel. Which teaching point is critical for safety? Answer: report any signs of unusual bleeding or bruising. Rationale: clopidogrel inhibits platelet aggregation, increasing bleeding risk. Early recognition is essential. 36. A nurse on a cardiac unit is prioritizing care. Which CAD client should be seen first? One with complaints of new-onset fatigue, one requesting information about discharge, one with stable angina after walking, or one with epigastric pain and diaphoresis? Answer: the client with epigastric pain and diaphoresis. Rationale: these can be atypical signs of myocardial infarction, especially in older adults or females. 37. A client with CAD expresses anxiety about future heart attacks. What nursing intervention supports both emotional and physical health? Answer: provide reassurance and refer to a cardiac support group. Rationale: emotional stress can worsen cardiac outcomes. Support groups aid coping and adherence. 38. A nurse teaching about risk reduction in CAD clients emphasizes which guideline for cholesterol control? Answer: LDL cholesterol should be maintained below 100 milligrams per deciliter or below 70 milligrams per deciliter in high-risk individuals. Rationale: lower LDL targets reduce the risk of plaque buildup and cardiac events. 39. During shift report, which client assignment should the charge nurse question? Assigning a newly admitted unstable angina client to a float nurse from pediatrics, assigning telemetry monitoring to an experienced RN, or having the LPN check vital signs in stable CAD clients. Answer: assigning a newly admitted unstable angina client to a float nurse from pediatrics. Rationale: unstable angina requires specialized cardiac care, which a pediatric float nurse may not be equipped to provide. 40. A nurse is planning care for a CAD client who is obese and sedentary. What is the most appropriate goal for the first week of lifestyle modification? Answer: walk for 10 to 15 minutes daily as tolerated, increasing gradually. Rationale: starting with realistic, manageable goals improves adherence and reduces cardiac risk without causing overexertion. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.